Thank you for your kind invitation for the slide. This is my topic regarding a universal convertible arthroplasty of the shoulder. This is my disclosures. You know that the revision of shoulder arthroplasty is always difficult. It's a big challenge, led to many complications. If you have to remove the humeral stem, the risk of humeral fracture. If you have to remove the glenoid component, the risk of fracture of the glenoid, the risk of infection, the risk of instability after reverse prosthesis. Many times there is a long operative time, 3-4 hours. You have to use allograft or autograft circlage, many bleeding operation, and this is a very high demanding surgery. So if you analyze the literature, you see that the rate of complication is very high. If you have to remove the humeral stem on the glenoid component, is between 22% to 40%. So this is an example. This is a glenoid loosening of anatomic total shoulder arthroplasty, a polyethylene wear, and the cuff is functional. You have to remove the polyethylene, you have to remove the cement, and after you see that there is a central bone defect. It's a good case because anterior and posterior wall are good. Sometimes it's completely destroyed and it's very difficult. Another example here, you see that there is no anterior wall. There is a big glenoid defect. We have to take, you see that the CT scan, we have no glenoid bone and it's not very easy operation. The patient was very happy during 10 years. And after with pain, we have to harvest the iliac crest bone. You have to take a big bone graft on the base plate, special base plate with a long peg. In the native bone, it's not so easy. So how to simplify the revision? This is a key question to decrease the rate of complication. Since for 70 years, I use a modular system. And we have a platform on the humeral stem and a platform on the base plate. But we can use now an easy reversible system. This is, for example, you can do a resurface prosthesis, or you can do a stemless hemicap, or a polyethylene inlay, or a stemless convertible. This is easy system. So if you do stemless, you bone preserving, short operative time, less bleeding, mini-invasive surgery. And the best, in my conception, is a stemless convertible. This is a test. We have no theory, but you know that with this system, you can convert, you can shift anatomic metal bag to reverse arthroplasty. And you keep the stem and you keep the base plate. So in 2003, we decided to design a platform system for the humeral stem and a platform system for the base plate. And you can use hemiarthroplasty or reverse onless system. You can do anatomic total arthroplasty with metal back or reverse with a glenosphere. So if you see on the market, many companies now use the platform system. Biomed, Doppio, Exatec, Tournier, Ascenflex, Integra, Smith & Nephew, Lavender. They use a platform system, onlay or most onlay or sometimes inlay. This is an example. This is a case, the young guy, very active, and the surgeon did hemiarthroplasty. But after 16 months, you see that the complete resorption of the great tuberosity, non-functional cuff with a superior migration of the humeral head. And in this case, if you have a platform system on the humeral stem, it's not necessary to revise it. We put reverse immediately without any removing the stem, and we obtain these results. So this is a multicentric study, meta-analysis of hemiarthroplasty or total shoulder arthroplasty to reverse. And you see that if it's not necessary to remove the stem, the rate of complication is 6.5, iatrogenic fracture 1, reoperation 2 40. Operative time is very short and no bleeding. And you see that the difference is a huge difference between stem exchange and stem retention. So we have limitation of retention. And in our experience with Jean Cany, we analyze the prosthesis that we change from hemi or reverse or anatomy to reverse, and we exchange between 0 to 33% the stem, because we use only system, and sometimes the humeral stem is too broad or malversion, or the joint is stiff. So if we analyze the clinical outcome of convertible platform humeral component, you see that this is a series of Castagna, Visser, or our series. You see that we shift hemi or anatomic to reverse. The constant score is 48, 48, 60. There is no pain. Forward elevation is around 120 degrees. On good external rotation, 30 degrees, because you lateralize more than the prosthesis of Visser or Castagna. We have no complication, no infection, no revision. If you consider the platform, the glenoid component platform, there is 2 series, and Weber published 15 cases of anatomic. We published 30 cases. You see that the constant score is 63, 145 degrees, and 25 degrees. And in this series of 13 cases, we didn't change any glenoid component, but we changed 3 humeral stems. But we had no pair or postoperative complication, no infection, and no revision. I published a series of anatomic total arthroplasty with a full polyethylene cemented and with a good cuff, and we shift polyethylene cemented to anatomic metal back. We had no complications, and you see that to anatomic metal back, you see that the constant score is 71, good forward elevation, good external rotation. And I didn't change the humeral component. I changed only the polyethylene component, and I revised with anatomic metal back. So we know that if you have a platform system on both sides, humerus and glenoid is very easy to revise. This is an example here, anatomic with a curved tear, and we revise to a reverse prosthesis with excellent results. This is another case here of anterior dislocation. We revise with a reverse. We didn't change any component. And this is a Lima prosthesis, and with the same concept. So my first conclusion is that if you use a dual convertible system with a platform on the humerus on the platform of the glenoid, you facilitate the revision when there is a problem. You reduce the operative time. You are less aggressive on older patient. It's not necessary to put bone graft, less bleeding. You decrease the rate of complication, and you can obtain a very nice objective, functional, and subjective results. So in the future, I think that if you use the stemless, you have to design a stemless with a platform system on the humeral side to decrease the risk of complication when you have to revise the stemless. Thank you for your attention, and welcome in Paris in 2022 in February. Muchas gracias.